Patients who have type 2 diabetes will lose their beta cell function over time. Now, when I first meet that patient, if they are very symptomatic, they have a very high A1C, they may need to start insulin right then and there. But otherwise, over time, they will lose their beta cell function. They have insulin resistance. That insulin resistance beats up on the beta cell, and over time, they're going to use up their own beta cell and their ability to produce their own insulin. And we're actually doing them a disservice by not talking to them about that from the day we meet them, so that they understand it's not something they did wrong, but it's the nature of the diabetes. And so over time they're going to need insulin, and we shouldn't delay that. And they should understand that they're going to need perhaps a basal insulin to start, and that as that beta cell weans more, that they're going to need a rapid-acting insulin before meals to cover their food. But it's a progressive nature of the disease. It's something we understand. Patients need to understand that from the get-go. And as a healthcare provider, we need to feel more comfortable with insulin so we don't delay the start.
When I start patients on insulin, I teach patients how to titrate insulin every 3 days to a goal, because I have seen providers who may start insulin and then ask patients to come back in 3 months. You will not see any good outcome. You need to titrate the insulin on a regular basis. That's why it's important to teach patients the goals we're looking for. So I tell patients your fasting sugar in the morning should be 80 to 130. If you check your sugar 2 hours after a meal, should be below 180. If I start a basal insulin, I tell patients, if your fasting sugar is above 130 after 3 days, go up on the basal by 2 units until they reach that goal. Then they look at their postprandials, and then they can adjust the mealtime insulin. That's why it's important to educate patients when we start insulin on how to adjust the insulin, and that's how we can reach a successful outcome.
I think we underestimate patients' concerns about starting insulin, although with the appropriate education, I have found that patients will move on to insulin. They just need to understand the reason why. But it's really important to talk to them when they are concerned about starting or resistant to starting insulin. What is your concern? Be real open with the questions. You know, it may have been that they watched someone start insulin, and that's when their complications started. Well, it isn't that their complications started then because of the insulin. It's probably because their control hadn't been good up until that point. So I think you need to find out from the patient what's going on with them that they don't want to start insulin, or you perceive. And sometimes it's because they haven't been asked. So ask that question. What is your concern? And talk it through with the patient. So I am concerned that people will look at me differently. I'm concerned that it will impede my ability to go out with my friends at night, or it will limit my activities. And usually you can talk all of those things through with the patient. They may be concerned about how to time it. They may be concerned about the size of the needle. And most patients think that the needle's about this big, when we know that they're very small, very sharp, and very easy to use. And in my practice, I make sure they get an injection before they leave my office. And most of the time they're like, is that all it is? I should have done this sooner. And it helps them feel better. So talk to them about that. Are you up nights going to the bathroom? This will help with that. The other concern is the cost. And all medications for people with diabetes can be costly, but there are co-pays with insurance, and as we increase the dose, sometimes if we have to increase how many boxes or how many vials, sometimes that affects the patient's cost as well. So being concerned about those things and working that through with the patients as well is really important.